Hello, and welcome back to 10 Minutes With. Today I'm joined by Victoria Hedley of Newcastle University. Welcome, Vicky.
Thank you for having me.
Today we're going to be talking about the European reference networks. So can you jump right in with an explanation for the people at home? What are the European reference networks, often called ERNs, and why should people know about them?
So ERNs for me are the most exciting thing to happen to rare disease in Europe, actually probably ever, to be honest.
Oh wow, okay.
So they are a set of networks. So they are set up at quite a high, broad level. So, rare renal, rare liver, etc. And there's 24 of them. So they launched officially at the start of 2017. And the idea is that across those, the group of ERNs as a whole, so the 24, that all rare diseases, all the thousands of conditions that there are, would have a home somehow under one ERN or another. And they kind of grew out of years of project-funded networks for maybe really specific rare conditions where communities came together, set up tools to advance care, diagnostics, treatments. But this was really just scaling that up on a massive level. So they connect virtually. Each one connects all of the top centres in a particular broad group of diseases across Europe. So these might be specialised units, specialised hospital, clinics, etc.
Okay. I was just about to ask for the people at home centres, so that can mean a variety of things, but it's sort of a hub of care in a very broad definition.
It is, yeah. And they're exciting because they are really the first structures in the rare disease space that span the care and research domains. So we've had, pan-European research networks before. These were the first networks of their kind really dedicated to advancing care, and that first and foremost is their mission. It's about breaking down barriers and reducing that postcode lottery, that geographical lottery that you have, which brings so many inequalities. But they do also importantly have a research goal, which is really essential for rare disease, where so few conditions still have treatments.
Amazing. That was such a comprehensive overview, so thank you. Can you take us back to the beginning? Where did the launch happen? What was the actual mechanism, the process of taking this from a big dream into something that is actually making tangible change for people?
So it was a really long road actually to that launch in 2017, and a big moment really came with the passage of some legislation called the Cross-Border Healthcare Directive in 2011, because that was where ERNs were really described in a particular article as being really important for areas where you need a concentration of expertise in really specialised healthcare. So rare diseases are not the only beneficiary of that. We've also got to think about, procedures which need a concentration of expertise, like paediatric transplantation, for instance. But they're a natural beneficiary. So that was a really key step. But even then, the idea for that didn't come from nowhere. Actually, EURORDIS was instrumental from the patient side in coming up with this concept many years before that. And then it was evolved through many European expert groups and different projects.
Obviously, the networks have grown, they've developed, they've evolved quite a bit since those early days in 2017. What would you say are the major challenges, but let's also, I would like to put a positive spin on it, opportunities for improvement going forward and looking to maybe the more distant future of the networks for their longevity?
So I think, just the creation of the ERNs was a massive undertaking for the coordinators, but actually all the other centres. So
slightly miraculous in its own way.
It really is. And because ERNs are first and foremost dedicated to care, I think it's natural that a lot of the first 5 years for sure were really focusing on that community building, getting the tools up and running, and engaging those other centres, because a big challenge was that the limited funding that the ERNs have had in the past for the coordination funding is really very minimal for what they had to do. And the partners they were working with in terms of the other members of that ERN, they didn't have grants, the traditional grants and a pot of money to hire somebody to work on this. So you're relying on sort of selling the vision to other clinicians, other units, other specialists. So that wasn't an easy thing. The funding is a little bit better now, because instead of having to apply kind of every year for the coordination funding and doing all of the bureaucracy and all of the admin, which was, really just such a waste of these experts' time. So it is a little bit better now, and there's longer term funding for the rest of this, what we call the multi-annual financial framework. So up until I think 2028, things are okay. We need to think beyond there.
And so taking this to the people at home, we've talked about ERNs obviously in quite a high level and quite a technical manner so far. What is it about ERNs that people at home should know? If they could go away from this with one key piece of information and one key takeaway about the ERNs, what would you like that to be?
I think it's to let people know, first of all, that ERNs exist, and this is an issue. This is always an issue with these, some of these big European initiatives, and they are initiatives actually. ERNs. It's important to stress they're not projects, even though they've had kind of project-type funding to keep them going. The idea is that these are here forever, and they are innovations, permanent innovations that will sit at this sort of marvelous high level, anchored in all of our centres in Europe, but that they truly get anchored into our national levels. And you asked me earlier, where do we need to still move? And that probably is the key area, because at the minute, it's as if all the tools are kind of in place. So you have the ERNs, you have this nice system and tool for doing virtual care, virtual consultations. So if you're not lucky enough to live near, to the top specialists in your particular condition, the idea is that for those really complicated cases where you need the best minds in Europe coming together to look at your information and your case, you'll be able to do that. Your physician can refer you into the shared care of the ERN, and you can get advice on, whether you would be suitable for a particular specialised surgery, for instance, or what could be done to prevent your condition getting worse. But you can only do that, and you can only use those tools if you know about them and if you know that they're there. There should be, more research stimulated by the greater data collection and the, new registries that the ERNs are developing and data linkage. So there's been a little bit of a barrier to ERNs doing research. For one hand, doing research requires some funding, and so we really probably need more funding calls which are just for ERNs to do research. And we also need to foster more collaborations with industry, because we know that partnering with companies, pharma companies, is so important if we're going to get the drugs that we need, going to get the medicines and better medicines. So I think these are all avenues to try to help ERNs to really realise that research potential, because they have so much potential to really, revolutionise care and research and just drive forwards the pace of knowledge. So we just need to have those pieces that are there kind of linked together and really embedded at the national level.
So that's really interesting, actually, the point you made earlier, which I'd just like to go back and touch on. So we hear a lot of the time from people in the EURORDIS community that actually some of the innovations that came out of the pandemic really increased accessibility to certain services for so many people, be that teleworking, telehealth, so many examples that frequently come up. So what do you think for you are the next steps? You specifically earlier mentioned virtual health, but more broadly for the ERNs in general?
I think the virtual care angle, so there's a platform that a system that the ERNs all use, which is called the Clinical Patient Management System. As of maybe end of 2022, early 2023, we were up to, I think, over about 2,600 cases had been referred through that, which is actually really good, because remember, that tool is really there to organise sort of whether real-time virtual meetings or virtual consultations where doctors or physiotherapists or whatever it is can check in their own time. But you get that kind of personalised approach, and that is just for the most complicated cases. So that's working, that's happening, the system's evolving. I think what's next is really sort of scaling that up to bring in, people who are not necessarily, or doctors who are not necessarily directly part of that ERN ecosystem. They're maybe not based in one of the member centres, and especially open it up to the countries where there maybe isn't so much expertise in particular conditions. So that sharing is really important.
And to end, I'd like to, we've given our advice to the people at home, we've given our advice to the policymakers. So what would be your piece of advice to healthcare professionals?
I think that ideally they can be, the European Reference Networks organise, they have great websites, they organise all sorts of training, webinars and things like that people can join. So, find the ERN that's in your field, in your domain, have a look at who's involved in your country. There are nice maps now that the European Commission provides where you can search for, say, all the rare bone disease member centres in your particular country. So find out what's where at the ERN level, sign up for their newsletters to find out what they're doing, what webinars they're doing on particular conditions. But I think, in terms of really getting them more engaged, we probably need to do a little bit of a top-down push there from our policymakers.
Yes.
Ideally, they should be, reaching out to the medical and the social professions as well, because, we need that integrated approach.
Of course,
and
yeah.
they should be, working with individual centres who will see some rare disease patients, but are not kind of maybe the top centres in their country. There's a new European joint action, which is just means a joint project, which is looking at exactly this, at how we can embed ERNs better at national levels. It's called Jardin, and that's just started. So I would watch that space as well, because hopefully by the end of that project, we will see ERNs not just sort of sitting very nicely at this pan-European level and doing what they do, but actually really reaching down into our national level and raising those standards.
Brilliant. Well, thank you so much for your time, Vicky. I have learned so much, if nothing else, so thank you.
It's been a pleasure. Thank you.